Welcome to the Therapy Trainings Podcast. I'm thrilled you're joining me today as we delve into an incredibly important topic: treating substance use disorders. This episode serves as a companion to the course titled 3 CE Hours Evidence-Based Approaches to Treating Substance Use Disorders, offered by Therapy Trainings. Today, we'll explore some key insights from the course, uncover effective strategies, and tackle some common misconceptions that surround the treatment of substance use disorders. So, what can you expect to learn in this episode? We'll start by discussing the foundational principles of evidence-based approaches, including cognitive behavioral therapy, motivational interviewing, and contingency management. Next, we'll take a closer look at the role of therapeutic rapport and how it can enhance treatment outcomes. Finally, we'll address some prevalent myths in the field of substance use treatment and wrap up with some thought-provoking insights that you can take back to your practice. Let's dive in. First, let's talk about what evidence-based approaches actually are. They're essentially strategies and techniques that have been rigorously tested through research and clinical trials to determine their efficacy. In the realm of treating substance use disorders, these approaches are not just best practices, they're grounded in substantial evidence that supports their effectiveness. One of the standout methods you'll learn about in the course is cognitive behavioral therapy, or CBT. CBT focuses on identifying and changing negative thought patterns that contribute to substance use. It helps clients understand the connection between their thoughts, feelings, and behaviors. For example, let's say a client feels overwhelmed by stress and turns to alcohol as a coping mechanism. Through CBT, they can learn to recognize their stress-inducing thoughts, challenge those thoughts, and replace them with healthier coping strategies. This shift in thinking can significantly reduce their reliance on substances. It's important to remember that CBT is not a one-size-fits-all solution. Each client's experience with substance use is unique, so a personalized approach is essential. By tailoring CBT techniques to fit the individual's needs, therapists can create a more impactful treatment plan. Next, let's explore motivational interviewing, another critical approach highlighted in the course. Motivational interviewing, or MI, is a client-centered directive method for enhancing intrinsic motivation to change. It's particularly effective for individuals who may be ambivalent about their substance use or hesitant to seek help. MI encourages clients to articulate their own reasons for wanting to change, making the process much more empowering. Picture this: you're working with a client who acknowledges their substance use but isn't fully committed to making a change. By using MI techniques, you can help them explore their ambivalence. Maybe they express a desire to improve their relationships or achieve career goals. By focusing on their personal motivations, you create a sense of ownership over the change process. This is crucial because the more invested a client feels in their recovery, the more likely they are to follow through with treatment. And then there's contingency management, a strategy that uses positive reinforcement to encourage desired behaviors. This approach involves providing tangible rewards for meeting certain goals, like attending therapy sessions or passing drug tests. It's like giving a gold star for progress. Research shows that when clients receive incentives for positive behaviors, they are more likely to stay engaged in treatment and make lasting changes. Now, I know what you might be thinking. Can rewards really create lasting change? Well, the answer is yes. Studies have shown that when clients experience immediate positive reinforcement, it can strengthen their motivation and commitment to recovery. It's about creating a supportive environment that recognizes and celebrates progress, no matter how small. Now that we've covered some of the primary evidence-based approaches, let's shift gears and talk about the importance of building therapeutic rapport. Establishing a strong, trusting relationship with clients is vital in the treatment of substance use disorders. When clients feel safe and understood, they are more likely to engage in the therapeutic process and open up about their experiences. Think about it. How can someone share their deepest struggles if they don't feel comfortable with their therapist? Building rapport isn't just about being friendly. It involves active listening, empathy, and validation. Clients need to feel that their experiences are acknowledged and not judged. A great way to foster rapport is through reflective listening. This technique involves mirroring what the client says, which demonstrates that you are genuinely engaged in the conversation. For example, if a client shares that they feel like a failure because of their substance use, you might respond with, "It sounds like you're feeling really down on yourself right now." This simple act of reflection can create a powerful connection, opening the door to deeper discussions. As we talk about these approaches, it's essential to address some common misconceptions surrounding substance use treatment. One prevalent myth is that individuals struggling with substance use simply lack willpower. This belief can perpetuate stigma and discourage individuals from seeking help. In reality, substance use disorders are complex conditions influenced by a variety of factors, including genetics, environment, and mental health. Another misconception is that once someone completes a treatment program, they are cured. Unfortunately, substance use disorders are often chronic conditions that require ongoing management and support. Relapse can occur, and it's crucial for both clients and therapists to understand that this doesn't mean failure. It's part of the recovery journey, and having a plan for aftercare can make a significant difference in long-term outcomes. So how do we, as mental health professionals, address these misconceptions? Education is key. By sharing accurate information and fostering open conversations about substance use disorders, we can help reduce stigma and promote a more compassionate understanding of these challenges. As we draw closer to the end of our discussion today, let's reflect on some thought-provoking insights. The path to recovery is rarely linear. It's often filled with ups and downs. As therapists, we must be prepared to meet clients where they are and adapt our approaches accordingly. Each client is unique, with their own set of experiences, motivations, and barriers to change. Incorporating evidence-based practices is essential, but it's equally important to maintain a flexible, empathetic stance. The therapeutic relationship should be a space where clients feel empowered to explore their thoughts and feelings without fear of judgment. I encourage you to take the insights from this episode back to your practice. Consider how you can apply these evidence-based approaches while also fostering a strong therapeutic alliance. Remember that the journey of recovery is a collaborative process, and your role as a therapist is to guide, support, and empower your clients every step of the way. For those interested in diving deeper into this topic and exploring additional resources, I encourage you to visit therapytrainings.com. There, you'll find a wealth of courses, including the one we discussed today, that can enhance your understanding and skills in treating substance use disorders. Thank you for joining me on this episode of the Therapy Trainings podcast. I hope you found it informative and inspiring. Remember, the work you do is vital, and together we can make a significant impact in the lives of those struggling with substance use disorders. Until next time, take care and keep making a difference.